Posterior pituitary gland, also known as your neurohypophysis. It consists primarily of nerve fibers and neurosecretory cells that support the nerve fibers, whereas the anterior lobe is primarily composed of glandular epithelial cells. Special neurons in the hypothalamus produce the hormones oxytocin and your ADH, in which your posterior pituitary gland only stores and releases those hormones. These hormones pass down axons through the pituitary stalk to the posterior lobe, and secretory granules near the end of the axons store the hormones. So here, both hormones are packed into secretory vesicles, in which it is stored in the posterior pituitary lobe. Oxytocin and the antidiuretic hormone are synthesized or made in the hypothalamus. It is only stored or released in the axon terminal located in the posterior pituitary gland. Once those hormones are released, it will go to the capillary plexus of the posterior pituitary gland and will enter to the systemic circulation. The antidiuretic hormone, or also known as your vasopressin, maintains the water balance by promoting increased water reabsorption in the tubules of the nephron of the kidneys, resulting in less water in the urine. Again, it is called your antidiuretic hormone. So, gina-prevent niya ang pag-ihi. The hypothalamus regulates ADH secretion through osmoreceptors that detect changes in the osmotic pressure of body fluids. So, ang osmoreceptors, i-detect if there is changes in the fluid composition, is it concentrated or diluted. So, if na-dehydrate, for example, ang patient, decrease ang water sa body, so mas-sense na siya ni osmoreceptors. Okay? Mas-signal siya sa kay posterior pituitary gland, okay, secrete bisang antidiuretic hormone. Okay, so hindi kapag paihiyon, kaya you need to conserve the water. Okay, so causing less water to be excreted. Okay, so i-conserve ang water. So here, if you are taking in too much fluid, so damo imogin inom nga water, so ma-detect na sa yung mga osmoreceptors. Okay, it will again trigger the posterior pituitary gland. It will inhibit the release of your ADH. Okay, so ipa-ihion niya ka. Okay, again, there is more water now compared to the solutes. Okay, so you need to excrete it. You need to urinate it so that the level of your solute and your solvent or the water would be equal. Okay, until the water level would be normal. So this would be your nephron. This would be your Bowman's capsule, your glomerulus. This would be your proximal convoluted tubule, in which majority or approximately 90% reabsorption of water occurs. You have your loop of Henle, you have your distal convoluted tubule, and your collecting ducts. So, the water reabsorption occurs in the aquaporins, especially on the distal part of the nephron. For example, there is increased sodium level in the body, therefore it will increase the plasma osmolarity. This will be detected by your hypothalamus, in which it will stimulate your posterior pituitary gland to release your ADH. So in the distal part of your nephron, you're collecting tubules and the distal convoluted tubule, which are primarily driven by the antidiuretic hormone, specifically stimulating your principal cells that contains your aquaporins. Here in your aquaporins is where the water is reabsorbed from the nephron into the body, okay, by about 10%. So if there's increased water in the body, it will cause increased blood volume, increased blood pressure, and this will decrease the osmolarity, making the body in the state of balance or homeostasis. ADH also plays a role in vasoconstriction. There are receptors in your blood vessels for ADH. So for example, there is a case of infection or severe blood loss. It will trigger the vasoconstriction, in which it will decrease the diameter, making it it will decrease the diameter of the blood vessel, therefore increasing the resistance. Increasing the resistance would lead to increase in the blood pressure. A deficiency in ADH can result in a condition known as your diabetes insipidus. Individuals with this condition produce 20 to 30 liters of urine daily. So, damo sila may ginaihi or permi sila gapangihi. So, they become extremely or severely dehydrated. They lose essential electrolytes such as your sodium and your potassium, resulting in abnormal nerve and cardiac muscle function. The oxytocin stimulates contraction of smooth muscles in the wall of the uterus. Stretching of the uterine wall and the vaginal tissues late in the pregnancy stimulates the production of your oxytocin, so that uterine contractions develop in the late stages of childbirth. It also causes contractions of cells in the mammary glands, causing milk ejection or lactation, forcing milk from the glandular ducts into the nipple during breastfeeding of the newborn infant. Occasionally, commercial preparations of oxytocin are administered to induce labor if the uterus does not contract sufficiently on its own during childbirth. It is also given to women after childbirth to constrict blood vessels of the uterus to minimize the risk of hemorrhage. The stimulus here would be the cervical stretching, or the stretching of the cervix. So it will send signals to the hypothalamus that will stimulate the posterior pituitary gland to release the hormone oxytocin. Your oxytocin will also bind to the receptors in the uterus or the uterine wall, causing uterine contraction. More contraction would also lead to increased cervical stretching. So again, the cycle repeats. Increased stretching would again stimulate your hypothalamus to release more oxytocin to increase the contraction until the baby will be expelled outside. Thus, it has a positive feedback. Next, your oxytocin is also responsible for milk ejection or for lactation. So here, you have your breast lobule here that is responsible for milk production, and you have the myoepithelium for the contraction until the milk will be ejected. So the stimulus here would be the suckling of the lactating breast by the newborn infant. So this will trigger the hypothalamus, okay, and your hypothalamus will also stimulate your posterior pituitary gland to release oxytocin. Your oxytocin will again trigger the contraction of your myoepithelium until the milk will be ejected. Then there will be more stimulus that will again trigger the release of more oxytocin. So in the lactation, it manifests a positive feedback. After the water broke and the loss of mucus plugs, the pregnant woman will now enter the stages of labor. So the first phase would be the active phase. It can occur around 8 to 20 hours. During effacement, the cervix is pulled upward during contractions, meaning there is cervical dilation, from 3 centimeters until full dilation around 10 centimeters. After achieving full dilation, then it will now be at the second stage, your fetal expulsion. There would be movement of the fetus through the birth canal, which is assisted by the maternal efforts of bearing down or pushing. So basically, the mother is doing the Valsalva maneuver until crowning is achieved, or the head of the baby can be seen. Next would be the placental delivery, around 10 to 12 minutes after the delivery of the child. The placenta is also expelled after the infant. The last part would be the postpartum period. It can occur from hours to weeks following delivery. It indicates return to a non-pregnant state. So again, this would be the cervical dilation. This would be the stages of birth, okay, or the 6 phases of the typical vertex delivery or the normal delivery. Then there would be an after birth delivery, or the delivery of the placenta. So this is an actual picture of the placenta. So this would be the 6 phases of a typical vertex delivery. First part would be the engagement of the fetal head in a transverse position. Okay, so here, there would be descent and flexion of the fetal head. Next, there would be internal rotation of the fetal head so that the baby's face is towards the mother's rectum. There would be delivery by extension. The fetal head passes out of the birth canal. So this is the diagram or the illustration. Next would be the restitution. The fetal head turns through 45 degrees to restore its normal relationship with the shoulders. So here, delivery of the posterior shoulder. This would be the image. Then you have the external rotation, so the shoulders repeat the corkscrew movement of the head until the baby is delivered. The summary of the posterior pituitary hormones. First would be your oxytocin. So it is important for the uterine contractions and for the lactation or milk ejection. For the antidiuretic hormone, ADH, or your vasopressin, it is important for water reabsorption and for vasoconstriction.